My name is Stacey, and I'm a speech and language therapist here in Malaysia. I work for the Energy Source, which is in Bangsar, Kuala Lumpur. I've been practicing here for about 8 years now, so I'm getting quite familiar. I'm originally from the UK, but I'm getting quite familiar with Malaysia and the cultural aspects. So today, I'm a paediatric speech and language therapist, and today I want to talk a little bit about myths about autism. So April is Autism Awareness Month, and we want to try and raise awareness as well as acceptance. Unfortunately, when it comes to autism, there is a lot of myths about autism, and unfortunately, these myths can cause a lot of stigma. And so then it can be really hard when parents get a diagnosis, or their child gets a diagnosis of autism, because of the stigma attached, because of these myths. And one of the big ones would be parents feel really guilty, and they think, was it me? So I'll just launch in, and I'll just discuss some of these myths and why they're not true. So the first one would be autism can be cured. Autism is a neurodevelopmental disorder. There is no cure. Maybe someday in the future there might be some technology that can assist, but in terms of a cure, anybody offering a quick fix, medicational fix, it will not, it might help your child with some of those signs and symptoms, but there is no cure for autism. It is a lifelong neurodevelopmental disorder. So this is kind of the major thing, and it doesn't really help. There's been some things in the media with people claiming to have their child was cured of autism. It's not true. Either they didn't have the correct diagnosis, children can definitely improve with therapies and treatments. They can definitely improve with regards to their functionality and their independent living skills. Definitely, that is, you can see a lot of progress. But as for a cure, it's lifelong. So just really have to emphasize that one. Which kind of ties into the next one, which is one of those myths is autism is a disease. I've had questions before from parents basically asking me how did they catch it? Autism is not a disease. You can't catch autism. You don't suddenly go out one day. You're not suddenly not autistic and then all of a sudden you are. It's something that you're born with. We might not recognize it until a little bit later. As I've mentioned before, you might see some signs at a very young age. But then you might kind of not really think about it too much because it's not very severe. But then maybe around about 5, then you might sort of think, okay, there might be something a little bit different about my child's development. So they haven't just suddenly got autism. They have always been on the spectrum. It's just that we haven't really been able to assess it accurately until maybe 5 years old. It's not a disease. It's neurodevelopmental disorder, and it cannot be cured. So that's major, very, very, very important, because these are the first two questions that really do come up. So speaking of cures, then one of the things, and this was in the media, I think, I'm not sure how long ago, maybe sort of 5 to 10 years ago, this was something that was big in the media. A famous movie star in the US came out and said that she cured her son's autism with a gluten-free diet. So I just really want to stress that diet can impact children who are on the spectrum or individuals on the spectrum. They can have dietary difficulties and they can have gastrointestinal difficulties. Not all children who are on the spectrum would have these, just like not every individual without, who's not on the spectrum would have this. So gluten-free diet can work if your child has specific difficulties, with wheat or gluten and handling that in their digestive system. However, it's not going to work for every child because not every child has these specific difficulties. So like I said, unfortunately, this is one of the things that I see a lot. I get asked a lot more these days, and it's because things like in the media, then you get all these people who found these magical cures, and one of them was apparently a gluten-free diet, and so just to really debunk that, it is not a cure for autism. Always get your child tested if you do suspect any allergies or any kind of stomach difficulties. Get your child tested, and then you can work on a diet if you need specific dietary requirements. You can work on that, but that would be specific to your child. So another thing that I find, another question that I get asked a lot, specifically, would be when a child would have that autism diagnosis, then, so it's not necessarily a question, it's more a comment, then the parent might say, oh, but my child is not great at the piano, or my child's not great at painting. So we often see, and I think this is not, again, it's the media, it's not really helped, with movies such as Rain Man, which is very old, showing my age. And even, I guess, more recently, TV shows such as Big Bang Theory, where Sheldon, he is, on the spectrum, and he has an eidetic memory. So not all children who are on the spectrum, we class them as gifted, or savants. So it's often a bit of a stereotype that if you have this diagnosis of autism, then the child must be gifted. They must have some magical, wonderful skill where, they're amazing at the piano, they're amazing at the violin, they have this amazing memory, or they're, wonderful painters. As with typical developing people, some have wonderful strengths, in this area. Some have wonderful strengths in this area, but some are just average, like you and me. So yeah, this is one of the common things I get asked. And I do work with some children who really, they're hyperlexic, which means they have exceptional reading skills from a very young age. I do work with children who have wonderful, strong memories, and they remember, almost eidetic. But not every child would be seen as, would be like gifted in that way. So it's just to really kind of, just to emphasize that, because it is one of those stereotypes that people think when you see a child with autism or an individual with autism, what is their gift? They can just be, like you and me, just typical, your average, So another thing that I often get asked, and this is one that really breaks my heart actually, is when parents get the diagnosis that their child would be on the spectrum, then they come to me, and so one of the things that we have to do as a speech and language therapist would be to support the parents and to kind of counsel them, because we work with the families very, very closely, because the therapy that we do in the centres has to be carried forward at home as well. So we need to make sure, the parents are on board, and we really need to work with the family as a whole unit. So it kind of breaks my heart when parents come to me and they say, basically, is it my fault? And especially mothers, is it something I did during pregnancy? Is it something I ate? Was it something I did wrong, like at the birth? And is it, am I not raising my child correctly? I've had all of these questions posed to me, and none of it is true. Yes, environmental factors may have an impact. And especially these days, you can see much more of a higher prevalence of autism, which there's ongoing research about, environmental impacts, but it's not bad parenting. And so I just really, really, really want to underscore that several times. It's not parenting. It's not anything that a mother did while she was carrying the child. Nothing like that. It's neurodevelopmental disorder. So it's basically like the wiring in the brain is just a little bit different to maybe you and I. And it's not a negative thing. It just means that there's a slight difference there. So it just means the way the child's going to learn, the way they're going to develop will just be slightly different, But then everybody on the planet is different, so we should just, accept. But it is just to really, really underline, it's not anything, it's nothing to do with bad parenting, it's nothing to do with, while the baby was being carried or anything like that. It's neurodevelopmental. And the next one, and this again is something because of a study that came out years and years and years ago, and this one is the very, very common one, is the MMR vaccine. There was a scientist who came out years ago and kind of had a research study that said the MMR causes autism. It's since been debunked by multiple researchers. It has been completely debunked. There is no causal link. There is absolutely no link whatsoever between vaccines and autism. I think one of the scary things, and this is why it's sometimes difficult for parents to get their head around this one, is because you would typically get those vaccines around about the same age as you would start to notice those early signs and symptoms of autism. So you can see why, parents would worry and be skeptical and think that there may be a link. However, it's just coincidence, really. There's nothing found. There's no research at this time. There's no research to prove that the vaccines have anything to. There's no link between vaccines and autism. So I really have to underscore that. So if you are, debating whether or not to get your child vaccinated, please do, because if you don't get them vaccinated for things like measles, whatnot, then you could actually, you're not just harming your child, but you could potentially be harming other children when your child goes to school. So you also have to think about that. So if your child's not vaccinated, then you could potentially be spreading something. And these are things that we've, almost eradicated now, but they're starting to come back because of this anti-vax movement. And like I said, I'm not judging, I'm just saying, I understand where it comes from and why you think that. But just please, if you do have any doubts about it in your mind, speak to a doctor, speak to a pediatrician, do your own research, check out proper research articles, and do some reading yourself, and you will find that there's no link there. There's no link. So vaccines do not cause autism spectrum disorder. It's a neurodevelopmental disorder. I'm going to say that after everything. I'm just going to keep repeating that one just so it really sinks in. So another very kind of common myth would be, so we have the one that I talked about earlier, which is the gifted child who is on the spectrum. And then the other kind of myth would be the child who's in their own world, sitting in the corner and are completely nonverbal and can't be touched. And yes, I mean, you do, like I said, you do have children who are on the spectrum who are super gifted. We do also have children on the spectrum who are very low functioning and have very, very severe sensory difficulties. So yes, it is difficult. They do struggle with that touch. And yes, maybe you're not able to give them a hug. That's where occupational therapists and other therapists come in, is to work on those sensory difficulties, to work on the integration, so that eventually then you should be able to give your child that hug. But on the speech side of things, a very common myth would be autistic children are nonverbal. Some children on the spectrum are nonverbal. Some children on the spectrum will be nonverbal for most of their lives, or for all of their lives. But as I kind of keep harping on about this, every single person is different. Every person who's neurotypical, every person who is on the spectrum with a neuro difference, we're all individuals, we're all very different. So some children, some individuals might be nonverbal, but not all. So just because you have this diagnosis of autism does not necessarily mean that your child will be nonverbal. And something that I like to kind of bring up as well when you talk about that is that if they are nonverbal, then as a speech and language therapist, then we'll do our best to work on giving them communication tools. So they might not be able to talk and express themselves that way, but we would give them other tools to express themselves. So one of the things I use is alternative and augmentative communication. So for example, iPad, we give them communication devices like that. So they can still express themselves, which is the most important thing. As long as they have an expressive output, then that's the main thing. But yeah, this is one of the big myths that I strongly dislike about autism, is that they don't talk, or they're going to be nonverbal. And even if a child is nonverbal, at the age of sort of 4 then it doesn't mean to say that they're going to stay nonverbal for that lifespan. Recent research has actually shown that a lot of children who are on the spectrum, actually who are nonverbal at a young age, develop language around about sort of 5 years old. So it's just that it's quite a significant delay, but it is just like that sort of delay. And I've worked with children as well who kind of, once they reach sort of, I've worked with children from 3 until about 5 or 6. Once they get to that kind of 5, 6 years old sort of threshold, then all of a sudden something sort of clicks in their brain, and then they start to kind of become verbal. To the point where I then have parents complain to me that their child doesn't shut up. They won't stop talking. So just to kind of, reiterate that. So the children on the spectrum can be nonverbal. It doesn't mean that it's going to be for life, but it might. Every child is different. I feel that's just the standard kind of answer that unfortunately we have to, say, because everybody is different. And then the last one would be that children on the spectrum don't have feelings, and they don't understand other people's feelings. This one is, I find, it's really upsetting actually, because children on the spectrum, they might not be able to show certain feelings as well as somebody else. However, I found personally from working with a lot of children who are on the spectrum, they're very astute and are very in tune to people that they get quite close with. So if I've been working with a child for quite a long time, and we do have that good rapport, I've had children who, maybe I've had some bad news in the morning and then I've had to go and, do some session. And I've had children who are quite low functioning on the spectrum, and they would just walk up to me and they somehow just know, I've said nothing, done nothing. I always walk into my sessions with a big smile. They sometimes just know. And I've had children come up to me and just give me a hug. And I'm like, how did you know? And it's the sweetest thing on the planet. But yeah, they're aware. It's just that maybe because of the social communication difficulties that they have, that they're not able to express, those emotions as well as others. And sometimes children who are on the spectrum, they don't pick up on those little nuances that we have. So they might not be able to read our facial expressions. So they might not be able to pick it up. But that does not mean to say that they don't have feelings, and their feelings themselves should never be kind of brushed under the table. I've had children that I've worked with, sit in a session and they become kind of, they can become a little bit frustrated if something I'm doing with them is a little bit difficult. Or they recall a memory from something that's happened earlier in the day. And I've seen, like children on the spectrum, just randomly they'll start to, shed a tear or something like that. So it breaks my heart to think that people would think that children on the spectrum don't have feelings. They do. And if anything, they seem to be sometimes just more aware of other people's feelings and almost empathic. I think just because they can't express it doesn't mean they don't have them. Some people who are not on the spectrum have difficulties expressing feelings, but they do get labelled, cold or heartless. And so I think this is something that we kind of need to move a little bit away from, because it's not easy for people sometimes to express themselves. So that's just sort of a brief synopsis for me. So just talking about some myths that I've come across in my time as a speech and language therapist, some things that parents have said to me, or some questions that have been posed to me about autism in particular. And I just really want to just go back and underscore, autism is a neurodevelopmental disorder. It cannot be cured. It's not caused by vaccines. It's not caused by bad parenting. We can definitely work on any of those difficulties that children are having, but at the moment there is no cure. So that's all for me.